Medical professionals have read it. When did you have to tell a patient, "I've seen it all before," to comfort them? But really, you had never seen something so bad, or of that nature.
Not medical professionals, but we were the patients. My daughter, who was 3 at the time, had to have a cavity filled. As we were leaving, the dentist told me just to watch my daughter because sometimes kids chew their gums because it's numb and feels weird. So the drive home took 30 minutes, and I had been talking to my daughter the entire time to keep her busy. I parked my car in my driveway, opened the passenger seat to get my daughter out, and her entire lower lip on the left side is gone. She had chewed it off down to her chin. She ended up in emergency surgery, but the surgeon kept telling us it would be fine, and he sees this stuff all the time. She ended up having multiple surgeries, and when she was finally healed, the surgeon told us that it was the worst injury like that he had ever seen. He wasn't sure how she would heal, but you can hardly tell it happened now.
Probably too late to the party, but I had a lady come in to the ER listed as multiple medical problems. This usually means diabetes and the issues stemming from it, or maybe bleeding issues from another disease, or maybe odd blood tests, results at a clinic. I hadn't seen the patient yet, but the doctor came to the nurse's station asking who had room 15. I jumped up and followed him into the room. I walked in and saw what I thought was a corpse. Then the patient's eye swiveled over to look at me. She truly looked like one of the people they found in a concentration camp. I could see every bone, and her body was twisted in a decorticate position with her jaw locked open. Then the smell hit me. Rotting flesh, death, and body fluids. I struggled to keep a neutral face and not gag. I tried to place a blood pressure cuff on her arm, and her skin just started flaking off in my hands. I gagged. The doctor started removing her clothes to examine her. Her feet were black to the ankles. Her hip bones were poking through her skin and were black. The skin around her ribs was worn away to oozing muscle fibers. Her calves were incredibly swollen, and the skin was splitting like ripped pants. I removed her depends, and there was feces coating her entire genital area. Then the doctor went to remove a large bandage on her lower back. Her entire sacrum was exposed, and the bones were black. The skin around it was a black liquefied mass. It smelled like nothing I've ever smelled. I can't even describe it. The doctor told her family I would clean up her ulcers and wounds in preparation for surgery. Liar, no surgeon would operate on her. I had no idea how to clean dead bone tissue and liquefied skin. They don't cover that in nursing school. When I went to clean her sacral area, all the liquefied skin separated and oozed all over the bed. I really struggled to keep my shit together. Afterwards, I needed a moment in the supply closet to cry it out for a second. I had no idea the human body could break down so much without dying. I still think about that woman sometimes and what led to her living like that. It still breaks my heart.